Well, it's just,
I know there's so much going on, and they're learning so much.
Their knowledge doubles every 10 years, and I've been out of school, well, almost 20, not quite. And so there's almost 2 or 3 times as much knowing as when I got out of school. Now, experience is wonderful, but there's all these neat new techniques and discoveries, so you have to use everything.
That's right, because I understand even food for pets, not only dogs and cats, but birds. You know, at one time people thought if they gave their bird just some seeds or a pet like an iguana or something.
No, they're
I used to have one, and you give them lettuce and a little water, and now you find out what should you be feeding him?
No lettuce.
No lettuce.
Yeah, no.
And yet, you know, he lived a long time.
He was
years
eating
ago.
scraps, I think,
Yeah.
actually, what kept him alive. Some of the scraps that he would get from the family's food table were probably better balanced than the lettuce he got. Iguanas will eat just about anything that's not tied down. Lucifer, come here.
Oh,
Oops.
imagine that. Oh,
Come here, Lucifer.
We said
Come on
he's
back.
enjoying himself, and now he's going to take off. And
The
he
jungle
said,
cat. Excuse me while I go get our little patient. Come here, Lucifer. Come here.
But,
Come
you
here.
know, that's the funny part, though. Lucifer is an interesting cat. Takes off. Oh, come on, Lou. Now, I know Lucifer is declawed in the front. Now, we don't really recommend doing the back declaws unless an animal is terribly
Well,
aggressive.
you don't usually need to do the back ones. You usually just have to do the front ones because they're the part that does the damage to your house and your couch and things like that. I'm not thrilled about declawing animals, but neither can I afford to buy new couches and new rugs every 6 months.
Now, he's using body language.
He's pissed.
Putting his
He's
little
very
ears
annoyed.
back. He thought he was going to take off into the
run off.
set.
He knows
He
better.
was saying how good he was, and then he was being bad.
Well,
You know,
he has
can
his moments.
Yeah. You know, I never thought until I met you and you discussed behavior that, now Lucifer's good because he's turning to be a good cat. He forgets and he forgives.
A few
he
times.
forgives. But sometimes you
He
take
doesn't bear
another
grudges.
cat that would bear a grudge.
And cats don't take discipline as well as dogs do, not
I
at
know,
all.
because I was surprised. I never thought of disciplining a cat the way you discipline a dog.
Well, you have to, basically you have to set a peck order up right from the start and have to have, there has to be one top cat or one alpha male dog in the house, and that should be the owner. It often isn't, but it should be. So I strive very hard when Lucifer is younger to set up a dominance order where I was the top cat. If I said, get off my couch, he'd do so. It usually works, not 100%.
Oh, that's funny. Now, what kind of special needs does an older animal
Well,
have,
see,
a cat or a dog?
As your pet gets older, you have to be aware and watching for several things. The first thing you have to remember is that there's a slow decline in the body's metabolic rate. Kind of like mine, too. I mean, I can't eat like I used to eat 20 years ago, or otherwise it shows right at my waistline. So as your cat or your dog's age progresses, you feed them a little less. There are special senior diets that have higher levels of fiber with less fat, because as they get older, that metabolism slows down. If they ate the same kind of food and the same quantity, they get fat.
Yeah.
Then, because they're overweight, you get secondary problems with arthritis and fatty liver syndrome and all kinds of nasty joint problems.
I'll never forget the time I was in the clinic, and it was a very elderly lady, and she had this Siamese cat that had the lot. They're usually slender, although I have one that's a little pear-shaped myself. But anyway, her cat weighed like 25 pounds, and you said, come into the office and see this. And I said to her, what do you feed your kitty? And
Whenever
she said,
he wants.
Yeah, and she said, oh, nothing. I said, you mean that kitty doesn't get treats? I couldn't even lift up the cat carrier. It was the most amazing
He was
thing.
about 8 or 9 years of age, and he was also fed whatever he wanted.
Oh, my goodness.
But he was always a big cat, but then in the last few years, because of his metabolic slowdown, he became a gigantic, enormous cat.
And
that
that's as hard as a person.
Oh yeah,
to
the
lose
obesity
weight.
is a big problem in animals nowadays. What happens is that's been linked with diabetes as well as the arthritis. I alluded to fatty liver syndrome, where the liver tissue is actually almost infiltrated by this fatty kind of tissue that just shuts it down almost, and it's killed a number of animals.
Oh, imagine that. And how long does it take a cat or a dog to lose a little weight? I know you have if the person was really serious and they truly kept him segregated
Well,
from other animals in the house.
It's
I mean,
difficult to do in multi-cat households. You
Right,
get, you know, a
yeah,
skinny one, a fat one, and it's very hard to monitor it. I mean, they should lose, maybe several, 2 to 4% of their body weight slowly and gradually every month, much like a person. You don't want to lose 20 pounds in a week because they'll just put it right back on. And the only way you do that with a cat or a dog is basically put them in a cage, lock the door, just give them water and a few breadsticks. Oh, they drive you crazy. I don't recommend that. It's much better to do a slow, gradual cut down that extra handful of food at night before they go to bed, and just kind of, you know, give them a couple of crumbles instead of half a bowl full. So you can do real well. There's also special diets, like we have a prescription diet called RD, reducing diet, high fiber, low fat, so they can eat as much as they thought they needed, the cat or the dog, and it's just high fiber with no fat or very little fat, and they'll fill them up but not out. So it works very well that way.
So they can conceivably go on their diet and then keep them more active.
Now, one thing that kind of is a little bit of a reverse sometimes in older, because old cats are a little bit different. Their dogs, when the dog stops eating, you know you got a sick dog. But many cats, and we can't really test for it as they get older, will lose their sense of smell. And their sense of smell is an important thing for appeal of food. They want to sniff it and, oh yeah, and they'll eat it. So that many times as a cat gets older, you have to feed a much more pungent food to keep them interested in eating. Sometimes they don't always get fat, but you'll see, weight loss is probably a greater concern in a cat when they get older, because an older cat who starts to lose weight can become, or can be a sign of hyperthyroidism. That's where the thyroid gland becomes very overactive. That's the master endocrine gland in the body, and they just literally burn themselves out. They're eating and eating and eating and eating, but since that gland is geared up to 2 or 3 times normal metabolic rate, boy, that was hard to get out. They literally become walking racks of bones within a couple of months.
No, because that's how you usually, there's a certain look about a much older cat.
They're a little skinny, a little more dehydrated. Their skin loses elasticity. Like, normally when you grasp a cat around the shoulders and pick up a fold of skin, it snaps right back in about 2 seconds. That's the test for dehydration. He's had his glass of water this morning. So that's a matter of, in the older cats, it'll snap a little bit slower just because the skin will lose elasticity. Also, their immune system is not as vigorous as it used to be, so they're much more susceptible to different viruses and diseases. I mean, a rhinotracheitis is an upper respiratory virus. That's something that causes sniffles and sneezes in a 3-year-old cat. In a very old cat, that can become bronchitis and pneumonia and be a real problem.
No, and it's a funny thing. A lot of people are afraid when they have a cat that's 16 or 17 to bring them in for a checkup. But you do regular I know, because you say,
it's even more important then.
I know.
The critters who need me the most are the very young and the very old. The very young to get a good start in life, to build up levels to prevent disease, and the very old to find a disease before it is a problem. You can prevent a lot of heartache and a lot of hassles and a great amount of expense. When someone brings in a comatose animal and they spend 2 or 3 days in Angel Memorial's ICU, it's very often a $1,000 bill these days. And had they dealt with it before it became comatose, it would have been much easier on the animal and on their checkbook too.
That's right. So we have to take care of even the older dogs and cats and bring them right in. Now, why is hip dysplasia? That's another question people ask all the time about a dog, if they have hip dysplasia. Why is that such a problem? To certain breeds, is that prone
it's
to
more
that?
common in certain breeds,
like
like
to get them
Labrador
X-ray.
Retrievers, German Shepherds, Newfoundlands, Rottweilers have been more and more common with hip dysplasia. Other breeds, of course. I've even seen hip dysplasia for only about twice. I've seen it in Chihuahua, so it can strike any breed.
I would never picture a
hip dysplasia.
Yeah.
You have the hip joint is a ball and socket joint. The ball being the head of the femur, and the socket being the acetabulum in the hip joint. And it's supposed to, your ball, that ball and socket joint moves around when you walk. In hip dysplasia, the socket is too shallow. The ball doesn't fit in quite right, and it gets a lot more lax and loose, and it really rolls around rather than have that nice tight fit, and you develop secondary arthritis. Okay, and so then you can see a dog. I've seen dogs as young as a year old crippled from it. So if you're purchasing a dog, you have to try to find out were the mother and father OFA certified. OFA stands for Orthopedic Foundation of America, and that's a certification where we take x-rays when the mother and the father are both 2 years of age or older. They then are seen by some radiology specialists. Those specialists are still out there. And the specialists, I think 2 out of 3 have to say perfect or good. And then they're rated or graded as OFA clean or clear. That's the best way you can kind of prevent the genetic predisposition for OFA.
Now, speaking of arthritis, I understand you have some new products to help.
I've been doing a
years
lot more with
ago-
nutrition.
Oh,
I must admit, perhaps I've been hanging around with your father too much. Listen to MayoCon talk about nutrition as though.
Because I can remember years ago, I had a collie that was 17. He was one of my favorites, and I mentioned that to you before, and he had such arthritis. And at that time, they would say, give your dog an aspirin.
Well, you
And that
shouldn't use
used to
straight
help
aspirin.
him,
Well, the
but-
aspirin would help for a while, but straight aspirin can cause stomach ulcers. So I don't recommend aspirin. I recommend using ascriptin AD. Ascriptin is an aspirin and Maalox compound together that will protect the coating of the lining of the stomach, so you won't get a stomach ulcer. You don't give them Tylenol, don't give them Advil. Those can be very toxic, and they're very sensitive to those medications. And never give a cat an aspirin. Actually, the first dose won't usually hurt the cat that much. Second dose can kill them. So
imagine
don't give
that.
kitty cats aspirin. But the new thing, like there's a new drug that came out from the Pfizer company called Rimadyl. Rimadyl has been a very, very safe and effective. I'd say I've seen at least 80% improvement on my animals, for dogs mainly. And this is a non-steroidal anti-inflammatory. If you use the steroids too much, you'll end up potentially causing another disease. So some of the other things I've been starting to work with a lot more are glycoflex and creocarb. These are compounds, nutritional compounds, the glycosaminoglycans, which help to restore and rebuild the cartilage. Many times in an arthritic animal, as you move that joint, the cartilage wears away. And so you get bone rubbing on bone, that hurts. These nutritional compounds, working with the perna caniculus, which is a muscle as a source of this product, this compound, help to rebuild the cartilage. It doesn't work overnight. It takes about, a month to 2 months. There's also a compound for older animals, creatine monophosphate or monohydrate, which has been useful in helping to put on weight and bulk up, improves their muscle
Yeah,
tone.
'cause a lot of the older animals get very thin.
Yeah, was a combination product even called creocarb, where they've had the creatine for the muscle tone and the glycosaminoglycans for the cartilage formation. So we've been juggling sometimes the Rimadyl for pain control and using some of the nutritional rebuilding compounds to help basically lessen the use of the pain control medication by helping to rebuild some of the damaged cartilage in an older dog.
Yeah, and I understand there is something for cats that's platable that comes in a tube, and a lot of people buy that, and that makes food taste good, or it's something that's
For
good
arthritis?
for them.
No, not
for arthritis, but just if you had an older cat that got very thin.
Well,
you can feed 'em
if they're not eating properly
Right.
because of their loss of smell or something, there's a compound we use called NutriCal. It's
NutriCal, that's what I was
It's a
thinking of.
high-calorie gel, and in about a tablespoon you can get a meal into a cat for a day. So a lot of times when I have an animal who's just been diagnosed as hyperthyroid, we've got them on the treatment for the thyroid problem, we want to put some weight on quickly, so we'll go ahead and give them some NutriCal as a supplement. You don't have to all the time, but it's a good supplement. Plus, it's a good source of carbohydrate for animals who are in kidney failure. They feel nauseous. They don't want to eat. They're not hungry because when the BUN gets up, they feel nauseous. So this is a good product to give them energy without straining their kidneys anymore.
And then our other thing is we can give them some fluids too, if they have a problem.
Well, fluid therapy is
At
probably
home.
the fluid
That's
therapy
your-
at home is kind of the last choice. You're
Yeah.
out of your nutrition didn't work, your
Yeah.
medications didn't work. When you're trying to give fluid therapy at home, you're grasping for the last straw.
I know.
It's worth grasping.
But
I
it
do
is.
It
It's
is.
worth
It is.
it. It's worth it. And gee,
Definitely.
you know, I can't believe the time is almost up.
Well, at least we got to talk about the older cat a little bit
I